52-year-old Mary White lives with her husband Ed in the small town of Coffee, Georgia. Mary was recently diagnosed with acromegaly.
Mary's a classic case of acromegaly. She has pretty much all the issues, the changes in physical appearance, the problems with blood sugar control, diabetes.
Mary suffers from the same condition as Igor and Tanya. But because she became ill after she'd been through puberty, meaning her growth plates were closed, Mary's growth is different. Instead of growing very tall, she has found that her face, hands and feet have grown.
My jawline is growing. My teeth are separating. My bottom lip's growing. My nose, a little rounder. My tongue is growing. It's actually getting thicker. My voice is getting deeper.
Having been diagnosed 2 months ago, Mary is scheduled to have the brain tumour that is causing her growth removed in 2 days' time.
I feel pretty good about the outcome, the physical outcome. I'm going to be a different person. I'm going to be normal, or as close to normal as I can get.
Do you not feel normal at the moment then, Mary?
No, absolutely not. As a matter of fact, one of my doctors even told me they could have passed me on the street and told that I had this disease. So it kind of puts it all in a different eye for me, that people can look at me and see things that are not normal.
Mary and Ed will soon be making the 5-hour journey to a hospital in Atlanta.
I'm scared.
Of course, I am nervous. It's my wife that's having this surgery, and I plan on being with my wife for the rest of my life. This surgery could change a lot of things either way. So yes, I'm nervous.
In 48 hours' time, Mary will undergo what she hopes will be life-changing surgery. Atlanta, Georgia is home to one of America's most prestigious hospitals, the Emory Clinic. Mary White has recently discovered that she has acromegaly, a condition caused by a tumour on the pituitary gland inside her brain.
Those words, brain tumor, would just drop your jaw. And that's the way I felt when I heard those words. There's a tumor in your brain that automatically you think your life is over.
Whilst not cancerous, this tumour produces an excess of growth hormone that means parts of Mary's body, such as her lips, skull and hands, have started to grow. Men and women are equally likely to be affected by acromegaly, and the average age of diagnosis is 42.
I have not felt normal in my life in so long.
Having recently been diagnosed at the age of 52, Mary is a good example of how acromegaly can affect anyone at any time.
To the best of our knowledge, nobody's protected from developing acromegaly. The majority of patients develop it sporadically. In other words, they literally just wake up and they have the condition.
Now Mary's scheduled to undergo surgery that will hopefully stop her body's growth and change her life forever.
For me personally, I hope that it gives me some sort of normalcy to my life. The peace of mind of knowing that the years that would have been taken away from me have been given back.
Dr. Nelson Oisiku has performed over 1,400 operations on pituitary tumours. But still there are risks with any operation inside the brain.
The risk of surgery in this type of operation include the risk of infection. And on either side of the pituitary gland lies an artery called the carotid artery. It supplies your brain with blood. And if you put your finger on your neck, you can feel the pulse of your carotid artery. So the surgeon operating in this area has to be exceedingly careful to make sure that he doesn't perturb the carotid artery because of the risk of bleeding or the risk of stroke. Above
The carotid artery supplies the brain with blood. Disrupting this artery could have catastrophic consequences. Later that evening, Mary is spending her last night before the operation with her husband Ed. Having heard how delicate the procedure is, she's fully aware of the risks.
And I still worry about the things that could go wrong anytime you're inside somebody's head and messing around with their brain. A lot of things could go wrong, so it's only natural to worry about that. But I'm not going to let it stop me from doing what I know I need to do.
In a few short hours, Mary will undergo the operation that she and Ed hope will mark the beginning of a new life. It's the morning of Mary's operation. The time has finally come for the tumour to be removed from her brain.
This is very important. I want to be with her, until, forever. And with this disease, there's a possibility that she wouldn't have but a few more years, maybe 6. And I want our life together to be longer than that.
Doctors will remove Mary's tumour through her nose using a technique called endonasal transphenoidal neurosurgery. Her operation will be carried out by a team of surgeons led by Dr. Nelson Oisiku, who is world-renowned in his field.
What we do is we go through the nasal passages into the sphenoid sinus, which leads you to the back of the pituitary gland. And we do that using an instrument called an endoscope. And an endoscope is a tube that's about that long that has light going through it and a lens that obviously allows you to see the field that you're working in.
As Mary's wheeled into surgery, her emotions are running high.
The thought of having an operation scares me. It always has. If I said it didn't, I'd be lying. You try to put on a brave front, but you can't not visualize or think about somebody going up inside your head and removing something and not be afraid.
You want to try lifting?
Mary's head has to be clamped in place because there's no room for error. As well as avoiding damage to the carotid artery, the surgeons also have to be very careful with Mary's optic nerve, which is situated just millimetres from the pituitary gland, and damaging it could leave Mary with impaired sight. Despite these risks, Mary is hopeful that the surgery will reverse many of her symptoms.
I know I have changed so much. I fought it for so long, but I know I'm not the same person. But I have hopes that I will be.
Most of the soft tissue changes we see in patients, once they go into remission and they stay in remission, you can actually see those reverse. The things that we have the most problems with reversing are things like bony structure, because those are hard and fast, if you will.
Two hours in, and the doctors have located the tumour. It's now a matter of cutting the growth away without leaving any damage. One slip could cause catastrophic results.
Cotton ball, please. Second specimen, permanent adenoma.
Finally, the tumour is removed. With Dr. Oisiku taking extra care to avoid the carotid artery and optic nerve.
That's an growth hormone adenoma. See how white it looks?
Very.
Yeah, very white.
The tumour measures about a centimetre across. Ironic that something so small can loom so large in someone's life.
Typically very whitish looking, creamy white.
After 3 hours, the procedure is over and the operation has gone well. But it will be 12 weeks before doctors can carry out tests that will prove conclusively whether they've brought Mary's growth hormone levels under control.
Hi there, Miss White.
It's the day after the operation, and Mary is awake, if a little groggy. Dr. Oisiku is visiting to explain how the operation went.
Everything went just as planned. We didn't have any problems whatsoever. We found the tumor, just like predicted, and we didn't run into any problems with the carotid artery or bleeding. So hopefully just a couple of days in the hospital.
While the procedure went well, conclusive proof of success will be available with the results from Mary's growth hormone test in 12 weeks' time.
If those are good, then there's a very good chance that you will stay cured for the long haul.
My whole family, my children and my grandchildren, my husband, they want their mama back. They want their Mary back. They want the same person on the outside that they know is on the inside. And they haven't had that in a while.
And for now, the future is already looking brighter for Mary, as Dr. Hoisiku is confident that the reversal of her physical changes is already underway.
You'll notice your features will get softer. Actually, I can also see already that they're getting softer. It's hard to tell for someone who's not used to seeing it, but once you've seen the changes in acromegaly, it's not too difficult to even discern very subtle changes at a very early stage.
I have nothing to do but smile and look forward to the future. I know things are going to be better. I know they are.
The early signs are that Mary's operation has been a success, and she should reap the benefits. Like Tanya, Mary recently received good news. 12 weeks after her surgery, she returned to Atlanta for tests. She has now been given the all clear.